I'm one of the dental hygienists here at Bright Smiles Dentistry. I get a lot of questions about gingivitis. How do I know if I have gingivitis? How do I fix my gingivitis? And I'm here to answer those questions today. How dangerous is gingivitis? Well, it depends on how long you let it go on. If you notice it and you come in and we can fix it together, it won't be dangerous at all. However, in the long term, gingivitis is the first step to things progressing to what's called periodontal disease, which over time can allow the teeth to fall out of your teeth. The good thing about gingivitis is you can actually fix it. But if you let it progress to periodontal disease, unfortunately, you live with that for the rest of your life. Can you have gingivitis and periodontitis at the same time? Yes, you can. Gingivitis is the first step that leads to periodontal disease. So you will always have the two together if it gets that far, especially if you have gingivitis. Flossing twice a day is really important while things get to a stable and healed place for you. So when should you schedule an appointment if you suspect you may have gingivitis? A great idea is as soon as you can. So whenever you come in, we will be able to clean your teeth so that we can rectify that gingivitis and make sure you can be in a healthy state moving forward. Well, I hope I've answered all of your questions when it comes to gingivitis, but if you have any other questions, feel free to call one of our amazing locations, or you can book an appointment with us on our website at brightsmilesga.com. We are here to help. Hi, I'm Sarah. I'm one of the dental hygienists here at Bright Smiles Dentistry. I get a lot of questions about how do I know if my gums are healthy and how do I keep them healthy? So I'm here to answer your questions today about that. So I get asked often, what are the signs of unhealthy gums? So if you think your gums might be unhealthy, you will notice some bleeding, which is called gingivitis. You might notice that the gums are swelling, or they might look a little poofy, or they might be tender. That can also be a sign. Another sign of unhealthy gums is if you see what we call recession, and that's where the gum tissue, I'll show here, and that's where the gum tissue will start to move up the tooth, or if you're on the bottom of the teeth, move down the tooth. Having healthy gums are also important for the fact that you are keeping things stable to ensure you can keep your teeth long term so that you can eat those delicious steaks whenever you're in your 80s. So I also get asked, what problems can unhealthy gums lead to? So it can potentially lead to a lot of things. It can lead to first having stinky breath. It can also lead to gingivitis becoming more severe, and that can lead to what's called periodontal disease. And periodontal disease over time can cause your teeth to get loose and actually fall out. What causes unhealthy gums? What causes unhealthy gums is not taking care of them properly at home. Whenever you're not brushing and flossing regularly every day, that bad bacteria will accumulate to where it will irritate the gums. Can those unhealthy gums be fixed? Of course they can. They can be fixed by coming in for a cleaning appointment with me or one of our other hygienists here at Bright Smiles Dentistry, and learning how to take proper care of your teeth at home with your toothbrush and your floss. So I get asked a lot of times as well, what is involved with the process of a deep cleaning? That's simple. So what would happen is you would arrive and we would make sure you were nice and comfortable. We actually get your gums numb, or if it's needed, we can use what's called local anesthetic to make sure you are completely numb and comfortable. So whenever we do a deep cleaning, I take a special ultrasonic instrument that has a tip that actually vibrates to help get any large pieces of buildup off of your teeth, especially in deep areas. A deep cleaning is necessary when we have to clean these deep areas down here where you have what's called bone loss from that bacteria eating it away. So when you're numb and comfortable, we can get down there and clean those areas very well without worrying about you being uncomfortable. After we are finished with the ultrasonic instrument, we use our specialized instruments that are bladed and sharp to get off any pieces that were missed with the ultrasonic instrument. So we make sure everything is clean and smooth, and we also are removing that bacteria from those deep pockets that otherwise you would not be able to remove yourself. At the end, we check whether with x-rays or floss or feeling all of those areas to ensure that we removed all of the buildup from your teeth. So why does it take 2 appointments to complete a deep cleaning? Most of the time for insurance purposes, they require that. A lot of times it is best, especially if there's heavy buildup, to focus on one side of the mouth first. That way you are comfortable, you're not stuck in the chair for a very long time, as well as you are able to eat food and drink on the other side of your mouth in case you are sore. And then at that second appointment, we clean off the other side of your mouth, and then your deep cleaning is complete. But if you are pressed for time and you would like to accomplish all of this in one appointment, just be prepared to spend a lot of time with me and we can take care of that for you. Whenever my patients need a deep cleaning, they always ask me if it's going to be painful. So my answer to that is no, because we actually numb you up to make sure you are completely comfortable through the procedure. So there are some recommendations I always make for my patients after they have a deep cleaning with me. A special mouth rinse to use at home twice a day that is really helpful for healing the tissues after the deep cleaning procedure. I also strongly recommend to be consistent with brushing twice a day and to floss twice a day, because the next 2 weeks are the most important when it comes to a new start with a healthy mouth. So some of my patients ask me when gum grafting may be necessary. The times that it may be necessary is when you have what's called gingival recession, and that's where the gum tissue goes up on the tooth or on the bottom, down on the tooth to a severe place enough to where it is possible the tooth may be unsteady. So a gum graft can be done to patch that area to ensure the health of your teeth. I hope I've been able to answer some of your questions on healthy gums, and you can always call one of our amazing locations or visit our website at brightsmilesga.com to schedule an appointment.